Hello, and thank you for joining us. Welcome to the 2022 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic is Start and Maintain an Active Lifestyle. My name is Carla Cox, registered dietitian nutritionist and certified diabetes care and education specialist, and your host for today's program. Our Ask the Expert series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, press star three, that's star three, on your keypad, and an operator will collect your question and place you in a queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the submit question button and your question will come directly to us. Stay with us through the hour and you will learn useful tips to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little bit about why we're here today. Each month, ADA is holding one or more free educational Q&A sessions. We'll cover information and tips to help you take charge of your health. Today, we are sponsored by Alignment Health Plan. And now I'm very happy to introduce Gary Scheiner and Dr. Michael Kadansky. Gary Scheiner is owner and clinical director of Integrated Diabetes Services, a practice located just outside Philadelphia, specializing in intensive insulin therapy and advanced education for children and adults. Gary is an exercise physiologist and has been a certified diabetes educator for 25 years. He has type 1 diabetes and has had it for 33 years. Gary was named 2014 Diabetes Educator of the Year by the American Association of Diabetes Educators. Gary is a writer, lecturer, educator, and volunteers for many of the organizations that support persons with diabetes. Dr. Michael Kadansky is a board-certified family practice medicine physician who has been practicing for more than 20 years. With a heart for serving seniors, Dr. Kadansky joined Alignment Healthcare in 2021 as a regional medical officer in Arizona, responsible for clinical outcomes and care coordination for Alignment members and patients. So, Gary, do you want to add anything to that?
Well, that was a very nice introduction. The only thing I would add is I've been living with diabetes for 36 years now. It's always a struggle. Every day is new things to discover and new challenges to come across. But I try to practice what I preach, and physical activity and exercise is a major part of my own diabetes management plan, as well as that of most of my patients.
Thank you. Dr. Kadansky, do you have anything to add?
Yes, I would just say that I've spent the last 20 plus years taking care of many patients with diabetes, and certainly more recently, my care has been more senior focused. I can also say I practice what I preach, but at times it is extremely difficult and challenging to find time in the day and to make exercise and living well a priority. But certainly it's a lofty goal and one that really makes a difference in the overall health for all of us.
Thank you. So as we're waiting for our callers and online listeners to chime in, I'm going to go ahead and kick it off with the first question. Right off the top, can you provide our audience with the single most important thing being active can do for your health? Dr. Kadansky, let's start with you.
Sure. Thanks for the question, Carla. And I was just going to say probably the most important thing to me is exercise and physical activity improves quality of life. And what I mean by that is by staying active, it improves overall physical functioning and allows us to do the things that are most important to us in terms of activities and stuff that brings us joy. And at the same time, the other end of quality of life is that staying active decreases the risk of developing or progression of chronic conditions and chronic illness. And so we can be healthier by staying active, and we can often reduce the impact that conditions such as high blood pressure, diabetes, or heart disease has on our lives.
Great. And Gary, would you like to add your best thing exercise can do for you?
I think we live in a society where immediate gratification rules. So I think the most important thing is it does make us feel good right now. It's not as if you have to wait 10 or 20 years to see benefit from physical activity. It makes you feel good mentally, physically, emotionally, right when you do it.
Perfect. Okay, so we're going to get started and ask people to call in. If you're just joining us, welcome to today's Ask the Experts Q&A, Start and Maintain an Active Lifestyle. As a reminder, for you on the phone, press *3 on your keypad and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button and your question will come directly to us. Remember, today's topic is about the importance of being active. So let's remember to try and focus on that topic for today's event. Okay, now let's take the first question. So this comes from Cheryl. Cheryl from Boysville, Wisconsin. Cheryl, you're on the line.
Yes, this is Cheryl Ann, and I'm calling to ask how exercise does reduce hypertension, high blood pressure, and the diabetic levels of high-low, and how can you go about doing that 30 minutes every day, or what type of foods can you eat that would help you to reduce some of that if you're looking at a goal of 50 pounds to lose?
Gary, you want to start?
Well, that's a lot of questions.
It is.
There was a lot of stuff. But I applaud Cheryl Ann. I applaud that you're looking to become more active and you're looking to get your weight down, because anybody with type 2 diabetes can benefit from both of those things. Physical activity is unique in a lot of ways. One of the major things it does for people with diabetes is it overcomes the root cause of type 2 diabetes, which is insulin resistance. When the body can't utilize insulin effectively, that's when glucose levels start to climb, and that's the underlying cause of type 2 diabetes. Physical activity gets right at that root cause. It improves our body's sensitivity to insulin. And as you know, as you're burning calories when you're active, it helps contribute to weight loss as well. So, and Dr. Gudensky can fill us in on some of the details, but physical activity is also a valuable way to reduce systolic blood pressure. And that's a challenge for everyone with diabetes. Heart disease is what ends up killing most people with diabetes, unfortunately. So maintaining a healthy blood pressure is paramount.
Great, thank you. Dr. Gudensky, you want to add something there?
Sure. I would say that exercise in particular benefits lowering blood pressure, reducing blood sugar, and preventing heart disease over time. And just the physical activity itself builds endurance to the point where your heart does not have to work as hard. And over time, it does absolutely reduce blood pressure. But the combination of reducing all risk factors for heart disease, so reducing blood pressure, reducing blood sugar, reducing blood cholesterol or lipids, all that happens as a result of doing exercise. And the combined effect is reducing the risk of having heart disease or heart attack over time. The other piece I wanted to mention is that it's really important to be patient and start slow, because small amounts of change, meaning exercise that can lead to 5 or 10 pounds of weight loss, has a dramatic effect on reducing blood pressure and reducing blood sugar. And so it's good to set a long-term goal, but often having a smaller goal to start has immediate and important benefits that will allow you to be successful over time, because it takes much longer to lose 40 or 50 pounds.
Thank you. And I might also add that just being not sedentary. So we always talk about an exercise program or being more active, but just not being sedentary is also helpful. There's a lot of information that getting up every hour or so and just walking around for a little bit or moving is helpful. So if you are really sedentary, you might think about starting there and then moving to other things. Okay, we have a question coming in from Tom from Galloway, Ohio. Tom, you're on the line. Tom, are you with us?
Yes. Do they consider riding a bicycle a good form of exercise?
All right. Let's start with Dr. Cadenzi, and then we'll go to Gary.
Well, I'm a big believer that all forms of exercise are good exercise. But that being said, a bicycle is often an excellent type of exercise because it's relatively non-weight bearing, so it doesn't cause a lot of pain on your joints, and is something that can be done for a long period of time and sustained without causing major injuries. So yes, often riding a bicycle in particular can be a great form of exercise. It just takes a while to build up endurance and to be able to do it for a sustained amount of time. So I always say it starts out as small distances and can develop to something bigger over time.
Great. Gary?
Well, Tom, cycling can be a great form of physical activity. You're in the Columbus, Ohio area. I know there's some nice bike routes, off-road routes around there. I mean, it's not for everybody. Not everyone enjoys or benefits a lot from cycling, but most people do. As Dr. Godensky said, it's a form of low-impact activity. You're not hitting anything with a lot of force. It doesn't put a lot of strain on the knees or the hips. Unless you crash into a tree, it's low impact. So it's generally a healthy thing to do. Cycling indoors is something that you can do while you watch TV, so you can keep yourself entertained. And when the weather allows, cycling outdoors is a great thing to do. I love outdoor cycling, but I don't like doing it in cold, wet weather, so I usually do it mostly in the summertime. I think it's nice to have a variety of activity options, because if you can't get out on a bike, or you just need to vary up because you're getting sore doing the same thing day after day, I think it's really worthwhile having a few different options. But if there's no reason you can't cycle, then it's a nice one to include in your repertoire.
Thank you. I'm going to put this one to Gary, and perhaps you also want to talk about physical therapists. But this is coming from Anna, and Anna is from New Jersey. Anna, you're on the line.
Yes, hello.
Hi, Anna.
Hi.
I'm a stroke survivor. I had a stroke in 2013, and my left hand and arm are paralyzed, and I can only use my right hand, and my left leg and foot are not right anymore. My sense of balance is out the window. I used to be able to climb the stairs, but because of the arthritis going on in my hand and arm on the right side, I can't hold the banister anymore. It's too painful. And my sense of balance is out the window. What kind of exercises can I do that are safe for me and I can actually benefit from?
Well, I would highly recommend that you take up pole vaulting right away. That sounds like it's right in your wheelhouse. I'm kidding. Don't pole vault. I love the fact that you're not giving up despite the challenges that have been thrown your way. Attitude is, I think exercise is 90% attitude or 90% inspiration and 10% perspiration. And you've got a lot of inspiration. You got the right attitude for this. That's what a lot of people lack. Don't lose that. There are always things you can do. There are options. Physical therapy can provide really good supervised activity for you. But for things you do on your own, there are armchair exercises that you can do. There's online videos, there's stuff on the internet, armchair activities that you can participate in. And you might also consider if you can find a pool that, the water's maybe waist deep, where you can walk in the water. You can use a kickboard. Water activity is great for people with limitations, especially people who have had amputations, who have severe neuropathies. It can be a wonderful way to get good, well-rounded physical activity without putting your body at much risk. Make sure you talk to your physician about what you're going to do, what your ideas are beforehand. these types of things are safe for most people, but if there's any specific reason you can't do them, your doctor will let you know.
Great, thank you. And I think the physical therapist, ask your doctor for a referral to a physical therapist because they can look at your specific challenges and help you find an exercise that'll work for you. So I'm going to punt this one over to Dr. Kadansky. This one is coming from Marla, and Marla is, if I can get her here, Marla is from Arizona. So Marla, you are live.
Okay, thank you for this opportunity. I just want to see implement some holistic approaches on meditation and how that can help with diabetes, along with yoga, Tai Chi, mindful eating.
Dr. Kadansky, you want to kind of discuss that?
Sure, I'd be happy to, and thank you for the question. I believe all forms of treatment have benefit, especially when it comes to managing diabetes. And anything that is really mindful, and what I mean by that, it helps you feel better, helps clear your head, and allows you to take on the tasks that you want to do, absolutely has benefit because it improves mood, it improves energy level, and really helps you feel better. I also like some of the forms of mindfulness exercise that you were talking about, particularly yoga and Tai Chi, because they are absolutely forms of exercise that improve both how you feel, they improve balance, strength, and flexibility. So they reduce the risk of getting injured over time. So I think there's absolutely benefit there. And I think, as Gary talked about earlier, really having a variety of exercises is the key to staying active and staying healthy, because any one exercise can get boring or repetitive over time, but having ones that you can mix in and that particularly help you feel good are going to make it much more likely that you can sustain it over time and continue to see the benefits from the exercise itself. So I'm a big fan.
Great. Super. Thank you. I do have just a note on here from online. It's from Rita, and she says, I'm so excited that Gary is here. I have all of his books, and he has helped me immensely. Thank you. I was diagnosed with type 1 diabetes in my late 50s, and I've noticed that when I'm running, I can actually feel my blood sugars rise and fall. So anyway, that's kudos to you, Gary, right there. Okay, so the next question coming in online is, I understand starting slow. How do you know when to push harder, increase intensity, or do more? Which one of you would like to take that one?
I could feel that. I believe that any workout session, if you want to think of it that way, consists of a choice of activity, how long you do it for, and at what intensity. It's important to build up the length of the workout first. So it's okay to start out at a relatively low intensity level, something that's very comfortable for you to do. And a good approach to that is making sure you can speak, at least in short sentences, without getting winded. If you can't speak in short sentences and you're getting tired and out of breath, you need to ease up. That's a way to know that the intensity is okay. But build the duration first. For most people, a 30-minute workout session is reasonable. It's going to provide nice benefits. If you're serious about getting your weight down, you're going to want to build up to something a little longer than 30 minutes, though. 60 minutes might be a more appropriate goal. Everything has to be individualized, though. But once you get to that goal duration, length of workout, then you can start to ratchet the intensity or the pace up just a little bit. And what's going to happen is your conditioning is going to improve. You're going to be in better shape. And that's going to allow you to pick up the pace, pick up the speed, add to the intensity a little bit. But as long as you're still able to speak without getting out of breath, speak in short sentences without getting too winded, you're not overdoing it. That's a good way to gauge the intensity level of your workout. If you're able to sing, you're not working hard enough. Now, I didn't say sing well, just sing, period. If you can sing, you can pick up the pace a little bit more. You shouldn't be able to sing in the midst of a workout. So somewhere between singing and getting out of breath from just speaking at all, that's where you want to be.
Great. So, Dr. Kadansky, I want you to respond to this one. This comes from Josephine from Phoenix, Arizona. Josephine, you're on the line.
My question.
Josephine, do you have a question?
Oh, yes, sorry. So my question is, being diabetic and overweight, also already having heart problems. So I have cardiovascular disease, and I've had a heart attack in 2018. I guess my question is, and some of it was already answered with knowing kind of when you're pushing yourself enough or not enough. But should I talk to my cardiologist about how hard I push myself as far as heart rate and that type of thing? Or am I just okay to, do things and listen to my body as far as pushing myself hard enough?
Hi, Josephine. I think that's an excellent question, and there's probably a two-part answer to it. When doing lighter activity or first starting out, I'm in agreement with Gary that listening to your body and taking a step back if you're reaching the point that you're breathless or short of breath, or if you're having joint pain or reasons that it would be hard for you to complete the activity, then you want to take a step back or slow down. That being said, especially having a history of heart disease, yes, I do think it's worth talking to your cardiologist, because they often will do two things. One is your cardiologist can give a recommendation of how hard to push yourself initially, but they may also be able to tell you, based on how you've been doing and past testing you've had done, if it's safe for you to push a little bit harder. So especially if they've done previous heart testing and said your heart's in good shape and it's okay to exercise, that's usually enough for me to be able to go out there and push it a little bit harder. So it is always worth a discussion and mentioning that's something you're interested in. And I can tell you, having worked with a lot of cardiologists, they are super excited when you're motivated and wanting to exercise, because exercise itself decreases the risk of another heart event over time, whether it's another heart attack or progression of your heart disease. So they are eager and excited to hear that, but it's worth having that discussion with them as well. And my other advice is, if you do have more frequent symptoms, like you've had chest pain, dizziness, or breathlessness, then even more important that you talk to your cardiologist first before ramping it up. For someone who's been stable for a long time, they'll tell you it's okay to get started with exercise, but listen to your body and really pay attention if you're having any symptoms that would make you worry more.
Nowadays, a lot of people wear heart rate monitors on their wrist, and it's a great tool, especially if your cardiologist has done stress testing on you, because they know what your maximum heart rate is, and they can determine an effective range for your heart rate to be in when you exercise. And it's a nice guideline, because if you got that wrist monitor, you can keep yourself within that target zone. It makes it not only safer to exercise, but more productive, because you'll be able to go longer. You'll be able to get into what we call a fat burning phase of your workout. So certainly check with your cardiologist, because they know more about your heart than anybody, and can maybe able to give you some more detailed advice than just, well, do whatever feels right.
Good. More objective. Okay, so I'm going to punt this one to Gary, as this is coming from Estella. Estella is from Delaware. Estella, you're on the line.
Okay. I've just recently had a hospital stay. I want to just let you know that in 2002 I was diagnosed with diabetes and fibromyalgia, and 2006 I had my first heart stent, and in 2015 I had my second heart stent. Now this time that sent me to the hospital was, they said I had a mild infraction of the heart, because my heart enzymes were up, and that I didn't, I overexerted myself. So now I can't even hardly get off the ground because I have a new situation going on and I don't understand it. What do you do to get yourself motivated when you have diabetic neuropathy with the feet burning on the top of my feet, the feet burning on the back of my legs? My hands are like having burning sensations. I'm tingling all the time. It's like I have muscle spasms. I haven't been able to get up and do anything. So I don't understand what has changed. You know, I can't get active. I don't know what to do to motivate myself to even get up and do anything.
Well, Estella, sometimes we have to hit rock bottom before things turn around. And it sounds to me like you're getting close if you're not there already. And you sometimes just have to say to yourself, I'm tired of this. I'm not going to let these things just keep running me ragged and pulling me down. I'm going to get my health in order. I'm going to work to get myself in better shape. Now, what you do is going to depend on a lot of things, but it sounds like you're at that point where you're ticked off at all this anyway, and you're ready to do something about it. You know, the neuropathy can throw a wrench into a lot of physical activity options, but it doesn't mean there's nothing you can't do. There's a lot of things you can still do. I think initially you'd probably benefit from some form of supervised activity, also something that's scheduled so that you show up on a regular basis. And cardiac rehab is a very good place to get started. So you might want to ask your doctor about options for supervised rehab sessions. It's sort of just getting you moving. You know, it's like a train. Once you start that train moving, it really goes. It takes some energy to overcome that inertia at the beginning, but once you get started, it can be great. And if you're anywhere near Christianacare in Delaware, in Wilmington, I know they have excellent rehab programs there. If you're further downstate, you could probably check with the hospital that you went to for your procedures. But I love the fact that you're just tired of being tired and you're ready to do something about it. But talk to your doctor about it and ask about the rehab programs that are available to you. They're available to people with Medicare or private insurance. And they're really a good way just to get you started in a safe, effective way.
Great, thank you. I do have some clarification. Someone has written in that wanted to know, the topic today is start and maintain an active lifestyle. And the presenters are Dr. Michael Gdansky and Gary Scheiner. So that's to answer your question. Okay, we're going to go on to Thelma. And Thelma, it writes in, and Dr. Kadensky, this is for you. Thelma is a 71-year-old person with type 1 diabetes for 50 years. She exercises 30 minutes every day, and lately she finds that her right foot hurts on the side, and she wonders if she should be concerned. Could you give her some advice?
Yeah, Thelma, I would say if it's a new problem in terms of your foot hurting and has not hurt before, and it's keeping you from doing the activities you usually do every day, then yes, it's worthwhile to have it checked out. I mean, sometimes it can be a simple injury that will recover with time, but certainly having diabetes for 50 years, there can be neuropathy or other changes that can cause pain as well, or even circulation changes to the foot itself. So I would say it's worth having it checked out to make sure there's not a more significant issue that needs to be addressed. But at the same time, there are times we find that it's either, arthritis or just activity related and nothing else needs to be done. But my advice is if it's bothering you enough to mention it, then yes, I'd at least see your primary care doctor and have it checked out and be sure everything is okay so you can continue with the activity.
Great. And another question comes in that is when should I check my blood sugar when I exercise? So I think depending upon what medication they're on, but that's a great question. Gary, you want to take that one?
Sure. I mean, it's wonderful if you can to check before and after. It provides some great feedback for you, immediate feedback about how that workout has benefited you. Almost all forms of exercise will help bring glucose down. There are rare instances where it may rise a little bit, like if you're doing weightlifting or something where there's a lot of adrenaline production while you do it. But it's nice to see that reduction in glucose. Everyone needs motivators, and that's certainly a good one. But anyone who is taking insulin, whether it's just long-acting or intensive insulin therapy, or if they're taking medications like sulfonylureas or meglitinides, these can all cause hypoglycemia. So it's very important to know your glucose prior to the workout to make sure it's safe, because if your glucose isn't at an adequate level, you could wind up with low blood sugar before you complete your exercise session. So it's ideally, check about 15 minutes before you're going to do the exercise, just to make sure you're at a reasonable level. And that reasonable level varies from person to person, depending on, your medication plan, what you're doing, when you last ate, things like that. But I think most of us know that, if your glucose is under 100 and you're going to exercise, you're probably going to wind up low. So you at least want to be above that level. And if you can get your hands on a continuous glucose monitor, any version of them is great to use, because you can see not only what your glucose is going into the activity, but also what direction it's headed. So if you got a glucose of 110 that's rising, you're probably fine. If it's 110 and falling, you better eat or drink something before the activity. And then, of course, at the end of the workout, you can look at the CGM display and see exactly how your glucose responded.
Great, thank you. And just as a reminder for you that are on the phone, press *3 on your keypad, and an operator will collect your question and put you in a queue. And then if you're online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. So we have another question coming in from Cheryl Ann. Cheryl Ann is from Wisconsin. Cheryl Ann, you're on the line.
Yes, what are some of the types of exercise that you can do that would be a higher intensity workout for someone with type 2 diabetes to lower their cholesterol levels and to lower their EC1 levels? Hello?
Yeah, I'm
Yes,
happy
Cheryl.
to
Oh,
question.
dear.
This is Dr. Kadansky, and thank you. Believe it or not, almost all forms of exercise, as you start to ramp up the intensity, have great effects on lowering blood glucose and lowering your hemoglobin A1C over time. The key, as Gary had mentioned earlier, really has to do a lot with intensity and being able to sustain that exercise for a longer period of time. So even walking at a more rapid pace, so where it increases in either your speed or the duration of walking, can have that effect. But as well, certainly cycling, swimming, and even the exercises that were mentioned earlier that were more related to mindfulness around yoga and Tai Chi can have additional effect. Weight training, especially if we're not talking about heavy weights that can cause injury, also can have additional effects. So there's a lot of different forms of exercise. The key is doing something that you enjoy doing and that you can continue doing in the longer term, and that it's fun for you, because ultimately if you're not enjoying a form of exercise, it's much less likely you'll be doing it 3 or 6 months from now.
Yeah.
Great.
Cheryl Ann,
Thank
where
you.
in Wisconsin are you from?
She's not on the line now, thanks.
Oh, we lost her. Oh, okay. I have a couple
Yeah.
of sisters in Wisconsin, and their form of activity, they love to play disc golf, and it's a big sport all over Wisconsin. But it shows you don't have to be, exercising per se to get those benefits. You can lower your blood pressure, your cholesterol, your A1C just by being active. It doesn't take a hardcore workout to do it. Because Cheryl Ann asked about high intensity, and it's just not necessary. Like you said, Dr. Gdansky, sometimes things like yard work and housework and shopping and disc golf and things like that, that's sufficient to get your heart rate up, get your respiration up, use your muscles more. those are perfectly fine forms of activity, and you can benefit from those just as much as you can with exercise.
Great, thanks. Okay, and Gary, this one is to you. Who on my care team would be the best resource to help design an exercise program if I have an injury, arthritis, or other challenges?
Yeah, it would be nice to say ask your primary care physician like Dr. Gudensky is, but unfortunately most don't have the the training in designing an exercise prescription or plan. If you have diabetes, ask for a certified diabetes care and education specialist. Most are pretty savvy at helping patients design a workout plan for themselves. If you need something much more detailed because of glucose regulation issues, or if there's specific sport training you're looking to do, then look for somebody who's an exercise physiologist or a personal trainer, and they could provide a bit more insight. But I think the first and probably the best person to deal with is a certified diabetes care and education specialist.
Great, thanks. Dr. Gdansky, this one's going to be for you, and it comes from Donna online. I am a 60-year-old female type 2 person with diabetes who almost lost my life last year to DKA. Since then, I developed POTS and neurally mediated hypotension. Exercise has been extremely difficult for me, now on insulin and gaining weight rapidly. Do you have any suggestions?
Yeah, that sounds like a complicated or complex list of conditions, and especially when you mention that you've had POTS, so you're more at risk for drops in blood pressure or passing out. And the truth is, you probably do have to start a little bit slower. And as Gary had mentioned earlier, some of the exercises that involve being in a chair may be more beneficial in the beginning because there's less risk of you falling or passing out. I think the bigger concern here is really having some expertise from an exercise physiologist or coach is going to make a big difference because they can design types of workouts that make it less likely that you'll have sudden drops in blood pressure. And just as important, they'll put you in a program where you have some form of supervision. So if you really are dizzy or at risk for passing out, there's somebody there with you. Because I really wouldn't recommend doing more intense workouts alone, knowing the risks that you have, especially around fainting or passing out. So I think the two keys there may be different forms of exercise, and having someone with a little expertise design a program would be really helpful, but also not working out alone.
Great. That's great advice. Gary, I'm going to send this one to you. It's coming in online. We have a lot of online questions today. This is from Karen. I now have osteoporosis. Are there strength training exercises I can do that won't hurt me? So not diabetes specific, but certainly an important question.
Well, for anybody with osteoporosis, there's certain degree of bone weakness, then weight-bearing activity is about the best thing you can do. It does not have to be strength training exercise, but any form of exercise you do where you're supporting your body weight on your feet helps to strengthen the legs and the pelvic bones, and that's usually where the greatest weaknesses and risks are. With strength training, you can do just about anything. I wouldn't recommend doing maximal weight type lifts. If you're doing submaximal weight with lots of repetitions, that's going to be very beneficial. And I think if you did a combination of submaximal strength training and weight-bearing activity that's more cardiovascular in nature, like walking, those are the best ways to improve your bone density.
Great. Dr. Gudensky, I'm going to start with you and then we'll follow with Gary. The question comes in, do I need to adjust my medicines when I exercise? And what would they be?
Yeah, so that can be a complicated question. And what I mean by that is many times you do need to adjust medications, but a lot of it depends on if the medications, like we're talking about diabetes medications, if they have a risk for hypoglycemia or causing hypoglycemia like insulin or sulfonylureas like lipizide, then yes, often over time, we do need to adjust medications because you can bottom out your blood sugar when you're exercising, as exercise can lower your blood sugar further. Other medications that are taken alone and are not associated with dropping blood sugar or hypoglycemia, like metformin's a good example of that, and even some of the newer medications like semaglutide or even medications like Jardiance. You know, when some of these medications are taken alone and not with insulin or sulfonylureas, they don't lower blood sugar as much, so it's not as critical to have to adjust medication doses. But that's definitely one you want to discuss with your doctor to let them know what you're doing. And by checking your sugars and knowing where your starting point is, you'll have a better idea whether it's going to be important to adjust medicine or whether you're high enough that you can get by without a major change. But I'd say particularly if you have diabetes and you're on insulin, the answer is yes, likely you will have to make adjustments. And if you're exercising enough and doing it right, over time, you likely will need less insulin overall. And so there really is a benefit to exercises in that it can decrease your medication need over time.
Great. Gary, anything to add to that?
I think what Dr. Godensky said towards the end, that know what your glucose is going in. Because if your glucose is elevated, you don't have to worry about reducing anything. You need the activity to lower your glucose, and it should be effective. But if your glucoses are running pretty close to normal or within your target zone, you may need to make adjustments. If you take insulin at meal times and you're going to be exercising after the meal, you're almost always going to need to reduce that mealtime insulin dose, and sometimes by as much as 50%. If you're only taking basal long-acting insulin, and anytime you're going to exercise, there's a risk of a low. So you have to make sure you do it either after a meal or you would need to have a small snack with some carbohydrates beforehand. And some of the medications Dr. Godensky mentioned, sulfonylureas and glutamides, those are really the only oral medications or non-insulin meds that can cause hypoglycemia. None of the other ones do. If you're taking one of those, the dose may need to be reduced, but you might want to wait and see how the exercise affects your blood sugar first. If it doesn't lower it very much, then you don't have to change your meds. But if it is causing your glucose to drop down into the 70s or below, you probably should talk to your doctor about cutting the dose back. And it's true, it's great incentive, being able to cut back or reduce your medication. That's one of the real benefits that physical activity can provide you.
Great, thanks. Dr. Godensky, I'm going to give you this one to start with. This one comes from Barbara. She's calling in from Michigan. Barbara, you're on the line.
Hi. I don't take any diabetic medicine. I'm trying to keep my blood sugar low without it by exercise and diet. But my last A1C was 8.1, and the doctor said that was an acceptable level. Well, I wound up getting a yeast infection, which wasn't addressed for 2 weeks because they misdiagnosed it and gave me estradiol. And then when that wasn't working, I called up to see my doctor, and she was on vacation. So I had to see another doctor, and she was the one who diagnosed the yeast infection. She said, that's coming from your high blood sugars, and she said 8.1 is not acceptable. Okay, now I was doing water aerobics, but I had to stop that because I got a great big cut and then on my finger, and I couldn't get it wet. And then they started renovating the pool, so I haven't been doing that. But I live in a colonial, so I'm up and down on the stairs, and I'll take a bike ride. But I'm tired a lot of the time, and I just find it so hard to motivate myself with all this other pressures that are going on. I can ride a bike. I don't like to walk because it hurts my back. I've got back arthritis, lower back from prior accidents, and I can go up north and I can get in a kayak. I'm 80. I just turned 84, but and I can do deep water aerobics, but I haven't for over a month because of those reasons I told you. So I think I'm getting in trouble, and I don't know just how to force myself to exercise to bring this 8.1 down. That's
Yeah, so Barbara, I'm excited that you're uh, mentioning all the details and that this concerns you because it tells me that you're motivated to want to make a change and to bring down your A1C or glucose a bit further. And you're right that sometimes by changing levels of physical activity, your sugar can go up. And so, there's a couple of different things to consider here. I mean, one is that sometimes sugar being high, that alone can cause fatigue and make you tired. So that can be part of the issue right there. The other thing to realize is that exercise can have a cumulative effect. So I'll often tell patients if they can only do 15 minutes of an activity and their goal is to do 30 or more, you can break it up into several times or several activities a day to reach that total. It doesn't have to be where I go and ride a bike for 30 minutes and that's how I get my activity in for a certain time period. So varying the activity and doing shorter, duration or bursts of activity often will allow you to get the exercise you need to bring blood sugar down. I mean, that being said, sometimes you also have to look at other things that impact blood sugar and are going to make a difference. And so diet becomes even more critical, especially if there are some limitations to what you can do with activity level. And there are times if it stays significantly high over time that we do consider a single medication to help bring it down because getting your sugar down a little bit further is going to help you have the energy to do more of the physical activity and the things you want to do. The last piece I'll mention is that some of our goals for blood sugar control do change over time, and it has to do with other medical conditions and age. Like I'll often tell somebody as they get significantly older, like over 90, that getting A1C under 8 or a little closer to 7.5 is enough because a lot of the complications we see from diabetes develop over 10 or 15 years, and I'm not that worried that they're going to live to 120 years old. So there are changes that happen over time that affect how we set goals. But really, the initial goal of getting that A1C under 8 is most important. And finding a combination of exercise that you can do, even if it's in smaller increments, is important. And then revisiting diet to see if you can make up some of the difference, but also thinking that there may be a time where a small amount of medication is needed. The good news is when you're saying your A1C is close to 8, it might not take that much medication to get you there if that's the ultimate decision that's made. And certainly it can be an oral medication.
Well, and I think the challenge often is everyone keeps thinking, well, if I just would be a better person and I would just exercise more and I would just eat healthier. But diabetes does change over time. And I think the concept of maybe you need to add a little medication and talk with your physician about that is reality. So you might feel a whole lot better and have a lot more energy if your A1C gets down to 7.2, 7.5. So great advice. Another question, this coming from Kay, and I think, Gary, this would probably be best for you. Kay says, is weight training equally beneficial to cardio for obesity and diabetes?
The ideal situation would be to mix the two up. Strength training has some unique benefits. It burns calories while you do it. It also burns calories while you're not doing it. And you can't say that about cardiovascular exercise. And what I mean by that is that when you build muscle, when you develop muscle tissue, it burns energy even when you're not using it. Muscle's very metabolically active. It's kind of like interest on a bank account. If you're getting 1% on your savings account, this would be like boosting it to 10% interest. You're just burning extra calories all the time when you have more muscle on your body. So strength training exercise can benefit you in multiple ways. It's also wonderful for overcoming osteoporosis. It's wonderful for just functional capacity, helping avoid falls and injuries and things like that. And for looking your best too. Everyone wants to look good. But it doesn't do everything. You're not going to get much in the way of cardiovascular benefit from strength training. You're not going to lower blood lipids from strength training. So cardio exercise, the traditional walking, cycling, swimming, those kind of things still play an important role. So if you want to build the best program possible for long-term weight management and good health, cardio should be done several days a week, and strength training should be done at least a couple of times a week also. The two together is a synergistic effect. It's very powerful.
Great. We do have an online question from someone. They said they still don't have an answer for when to check blood sugar after exercise. And we mentioned the continuous glucose monitor, so you can just look at it and see. But what about somebody that's doing finger sticks? Any recommendations there, Gary?
Well, if you check in, right after exercise, you'll get an idea of how the workout affected you. Did your glucose rise? Did it fall? Did it hold steady? And that's valuable for knowing what kind of adjustments you might need to make the next time you do it. It can also be motivational if there is a nice decline in the glucose. But you can see a continued drop even hours later. Intense workouts can sometimes cause a delayed drop in the blood sugar. And that's why you're going to want to check again, maybe 4, 6, 8 hours afterwards to see what it did. It's helpful to compare that to a day you didn't exercise and see if your glucose levels are different on the days you do, even post-workout. That's one of the reasons, again, I'm a big fan of the continuous glucose monitors for anybody who takes insulin in any form. They're covered by insurance, and you can learn so much more from those than you can just from periodic finger sticks.
Super. That wraps up our last question. So, Dr. Godensky, can you give us one main takeaway point that you want to make sure that the listeners take home from today? What would be your main point?
Well, I can share something that was told to me back when I was still in training by one of my physician professors who was a type 1 diabetic and was very religious about exercising and really taking care of his body. And that point is exercise is a prescription or a treatment in and of itself. And what I mean by that is it's a key piece to managing almost all medical conditions, either preventing or managing chronic conditions that you may have, and especially with diabetes. And so, as we mentioned earlier, exercising frequently and really building up to a more significant exercise regimen almost always leads to decreased reliance on medication over time. And I've had patients that have exercised, they've eaten well, and they've lost a significant amount of weight and were actually able to come off medications to the point where they really reverse their diabetes. And so that's not always true, especially if you've had diabetes for a longer period of time or you're a type 1 diabetic. But I can tell you with a lot of type 2 diabetics earlier on in the course of their illness, there's a dramatic impact from these types of lifestyle changes and particularly exercise. So to me, it is a prescription or a treatment, and one that really has a big impact on the other treatments that you may need to be on over time. So I strongly encourage people to start if they haven't started already, and to continue or build on their exercise and ramp it up over time, because it really does have a dramatic health benefit and is something that often gets overlooked.
Great. Gary, what about you and your one take-home message added on?
Well, I'm going to steal Dr. Kadensky's, because I think that's a wonderful one that he put forth. Managing diabetes is often compared to a stool with 3 legs. One leg is your nutrition plan, one leg is your medication plan, and one leg is your physical activity. If you pull one of those legs out, that stool is not going to stand. It's going to collapse. Physical activity plays an integral role in every aspect of diabetes management: the glucose control, the prevention of complications, the emotional aspects. I mean, just every aspect of living with diabetes is impacted by physical activity. So I encourage everybody to making an active lifestyle a goal. And again, you don't have to think of it in terms of exercise per se. It's just being physically active. You can get just as good a workout from raking leaves or mowing your lawn as you can from jogging for half an hour. So dancing burns just as much energy as as cross-country skiing. I mean, you can do just ordinary things throughout the course of the day that burn energy, make you healthier, make you stronger, that are part of an active lifestyle. So the next time you're at an airport, don't just stand on that moving walkway, walk. Next time you're at the store, you see an escalator, take the stairs 1 or 2 flights. It's good for you. Think about opportunities to be more active rather than opportunities to be less active.
Super. Thank you both so much. It's been a joy to work with you. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you and hope you will take a few minutes to provide us with your useful feedback. And so thank you for all the great questions you called in and wrote with. We are sorry that we couldn't get to all of them. But if you have questions about the event, you're welcome to contact us at ASKADA, that's AskADA at diabetes.org, or by calling 1-800-342-2383. Special thanks to our experts, Gary Scheiner and Dr. Kadensky. I'm Carla Cox, and on behalf of the ADA team, in conjunction with our sponsor, Alignment Health Plan, we want to thank you for joining us. And please remain online for our short 5-question survey. All right, so here are our survey questions. Number 1, overall, how satisfied were you with today's events? Start and maintain an active lifestyle. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. So once again, question number 1, overall, how satisfied were you with today's event? Start and maintain an active lifestyle. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. So 1 is not at all satisfied, 2 is somewhat dissatisfied, 3 is neither satisfied nor dissatisfied, 4 is somewhat satisfied, and 5 is very satisfied. Okay, let's go on to question 2. A regular exercise program is important because it helps to 1, reduce the risk for high blood pressure, 2, reduce the risk for heart disease, 3, improve balance, 4, improve insulin resistance, or 5, all of the above. Once again, a regular exercise program is important because it helps to 1, reduce the risk for high blood pressure, 2, reduce the risk for heart disease, 3, improve balance, 4, improve insulin resistance, or 5, for all of the above. Okay, poll question number 3. Which member of your healthcare team is best qualified to design an exercise program for you when you have an injury, arthritis, or other challenge? 1, the nurse, 2, the primary care provider, 3, the physical therapist, or 4, the dietitian. So once again, question number 3. Which member of your healthcare team is best qualified to design an exercise program for you when you have an injury, arthritis, or other challenges? Number 1 is a nurse. Number 2 is primary care provider. Number 3 is a physical therapist. And number 4 is a dietitian. And now we go to question number 4. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about how you can maintain an active lifestyle? Number 1 is not likely. Number 2 is somewhat likely. And number 3 is very likely. So once again, poll question number 4. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about how you can maintain an active lifestyle? 1, not likely, 2, somewhat likely, and 3, very likely. And our final question, number 5. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Number 1 is not likely. Number 2 is somewhat likely. And 3 is very likely. So once again, our final poll question, number 5. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management program? Remember, diabetes education programs usually require a referral from a healthcare provider. Number 1, not likely. Number 2, somewhat likely. And number 3, very likely. And once again, thank you so much for joining us, and we hope you will join us for our next session. Thank you.